Our report released today is based on our submission to the Women and Equalities Committee inquiry on the unequal impact of COVID-19 on people with protected characteristics and our webinar on disability in the context of coronavirus. The coronavirus pandemic has led to far-reaching changes to law and policy affecting disabled people in the UK. From measures around shielding the vulnerable to reducing the number of mental health professionals needed to make a hospital order under the 1983 Mental Health Act, to easing the duties on local authorities to provide social care to disabled people. It's clear that the UK government has failed to fulfil its public sector equality duties under the Equality Act 2010 and its obligations under the United Nations Convention on the Rights of Persons with Disabilities. The 2020 Coronavirus Act has wide range and damaging implications for the rights and freedoms of disabled people in the UK. The government's policy making in response to the pandemic has failed to fulfil its own public sector equality duties under the Equality Act 2010 with respect to disabled people and its obligations under the United Nations Convention of the Rights of Persons with Disabilities. The voices of disabled people have largely been forgotten, but the impact upon our lives has been dramatic. This month, the Office for National Statistics data has revealed that almost 60% of the COVID-related deaths are people with disabilities. Disabled women are 2.4 times more likely to die from COVID-19, and men with disabilities 1.9 times more likely to die. These levels rise to 11.3 times for disabled women aged under 65 and 6.5 times for men under 65. The ONS estimates that these are conservative numbers. Their data also reveals the disproportionate impact on BAME people in the UK. We need a disability inclusive response to COVID-19 as set out by the United Nations. We urge the government to undertake an immediate review of its legislation passed during the coronavirus crisis and ensure that its recovery and response to COVID-19 considers the multiple intersectional discrimination faced by people with disabilities. In doing so, we ask that the government changes all of its legislation to meet its duties under the Equality Act 2010 and its obligations under the United Nations Convention on the Rights of Persons with Disabilities.